All right, this is video 2 in your preparation for your mock exams. Now, this video is again focusing on medieval medicine, and we're going to focus today on why there was continuity. So, really important word for us to fully understand is this concept here, continuity. Now, if you're not sure what continuity means, it is very simple. Continuity means when things stay the same or there is limited change. So we need to understand why was there limited change during this time period. So, got three very clear reasons why medicine did not change, why there was continuity, why there was little change. So we've got your 3 points here, your three big reasons. Remember, you just need to remember three big things in history to do well. If this was a 16 marker or a 12 marker, you've got yourself here three secure reasons. So we're going to go through each one. Again, you need to always keep at the forefront of your mind, why was there not much change? So, reason number one, in hospitals. So, hospitals did not treat the patient, they only provided hospitality. They would only help people through prayer and keeping hospitals clean. So there's a bit of a mistake people make normally. They normally think hospitals are dirty. They're not. They're very clean. Hospitals would have no terminal patients, meaning anyone who was going to die was not accepted because they didn't want people to question the concept of God. Hospitals were also run by the church, which is a common theme during this part of the course. So again, they would only provide hospitality. Surgery was a definite no-go at this point because cutting the body would lead to people going to hell. The only surgery, which we'll talk about a little bit in education, was vivisection. But this was done on a criminal, and nobody would question Galen's ideas because they would blame the fact that the criminal had a different body. But hospitals would not provide any form of treatment. They were only providing care and prayer. And hospitals would only really be based in monasteries, and they were run by monks and nuns, not trained medical individuals. So, why did medicine not change? Because hospitals were ineffective. Hospitals only had one purpose, and that was to provide care and further proof of the divine. The next reason is education. So, education, there's a bit more to it, but again, there's a lot of repetition. So, just be very clear in this, be very careful not to confuse it because at times this repetition can become a problem. Let me just get this. Okay. So, education. Education does link to the church massively. I think we need to be very careful with this because if you ever got a question on this, similar to what people had last year, there would be aspects of repetition, which is fine to an extent. So, education does link to the church. The church controlled everything that people learned. So, everything that people learned about medicine was dictated to by the church. This included how physicians were trained, which meant their ideas were never going to change as no one could go against the church. So they dictated that concept that medicine should be derived around the concept of God. Also, medicine was very much dictated by the church in regards to Hippocrates and Galen. And now doctors were taught that everything that Galen did was correct in every single detail, meaning that actually nobody could experiment on or consider new ideas, which means the cause of disease was never going to develop because of the fear of going to hell. Now, physicians, they learnt from a book called the Articella. All books were written by the church, so no new ideas could creep in. So, in terms of education, just remember Galen and Hippocrates were the driving force. Their ideas were all the church pushed on top of the other ideas the church enforced. Now, remember, education in today's society, people learn through kind of doing dissections. Well, actually, they do learn by doing dissections, but dissections were illegal in the medieval period. But vivisections showed how education held medicine back. So a vivisection was a dissection on a criminal. You weren't allowed to do normal dissections, as we mentioned earlier in the video. Now, during a vivisection, if something was different to Galen's ideas, the criminal would get the blame. It was never considered that Galen was wrong. Nobody was ever going to change until the concept of Galen could begin to be challenged, and that didn't really happen until the Renaissance. The third reason is the obvious reason, which we've kind of repeated across hospitals and education. So, the church. It must be understood they were the most powerful institute in England, with nearly all individuals following the church. People wanted to go to heaven. So everything the church said about medicine, people listened to. You get ill if you sin. You get better by praying. You prevent illness by following a religiously positive life. Now, as I've just mentioned, the church had a major influence on people's ideas about what caused disease. So the Bible said that God controlled every aspect of life. So it was the logical idea that God sent disease. For example, leprosy was in the Bible and the Black Death of 1348. People didn't go against the idea that God was causing disease because of the fear of going to hell. And the church also significantly supported Galen's ideas, because Galen's ideas fit into the church, and a lot of people believe, well, the church believed that believed in their ideas of the soul. So the church wanted to support that. If anyone questioned Galen, they would go to hell. An example of this was a man called Roger Bacon, who criticised Galen, was put in prison for life, and excommunicated. So it just shows that the church had significant influence. That's all again you will need to know. Why did medicine not change? Three very clear reasons. You could talk about the government and how they use most of their money for war. However, in terms of building an argument, it's quite limited. You could develop the concept of poor medics and how medics were limited. Again, that will mainly become more descriptive rather than analytical. These three ideas, although they are separate, all have a common recurring theme of the concept of religion. So that's your short video on why medicine did not change in the medieval period.